Healing our nation's heroes.
Compassion.
Invested.
A family.
I think one of the things that makes us different from other commands is our compassion, our dedication, and our ability to go above and beyond in everything that we do, taking care of our patient population.
Caring.
Caring.
Caring. Quality care.
Team.
I am Naval Hospital Jacksonville.
I am Naval Hospital Jacksonville.
I am Naval Hospital Jacksonville.
We're the best at what we do. The 2,500 military, civilian, and contractors that dedicate their lives and their energy to take care of our nation's heroes, take care of our nation's families, and it doesn't matter whether they're past, present, or future. We take care of all of them, and we do it right here, and we do it better than anybody else.
In state-of-the-art operating suites, our general and subspecialty surgeons and staff deliver unsurpassed, evidence-based, family-centric care to meet the needs of our patients.
We're man-trained and equipped to provide that highest level of patient safety that's out there, that highest quality, that best outcome that you can have. You get right here at Naval Hospital Jacksonville.
Naval Hospital Jacksonville, it's a team, a family, with efficiency, with compassion, with one of the most talented and gifted medical staff. I don't feel at any time that I'm not connected with the team. This is a wonderful Naval Hospital Jacksonville team.
I come to Naval Hospital Jacksonville for all these years, total of 24, is because I'm very confident in the care that I'm going to receive when I get here and how they're going to take care of me. The care I've received here at Naval Hospital Jacksonville has been awesome. It's been great. I couldn't ask for anything better.
Here at Naval Hospital Jacksonville, I felt very comfortable with the decision making for my care. I was in it from day one up until the end.
It's always good to know that Naval Hospital Jacksonville is always here just in case. Because my dad's my hero, and if anything happens to him, it's always good to know that he'll be taken care of.
Here at Naval Hospital Jacksonville, we have a dedicated team of military and civilian physicians, nurses, support staff, corpsmen, who truly go above and beyond every day to provide quality care for our patients. It has truly been one of the best places I have ever worked.
I'm in my late 20s. I work out, I look after myself, and I try to stay focused on my career. So why worry about my health now? A visit with your healthcare provider is the best time and place to learn about your health risks and make sure you're taking preventive steps for a lifetime of good health.
All right, sounds good. Thank you very much for your help.
You're welcome.
I appreciate it.
In our busy line of work, staying on top of health concerns doesn't have to add to the stress. I learned there are a lot of easy changes you can make to your everyday life to take control of your health before any issues come up.
No matter your age or background, you can always find ways to prevent disease and injury later in life. With simple steps like eating healthy and exercising 30 minutes a day, you can assure yourself the best possible health as you move forward with your career and home life. Take control of your health. Visit your healthcare provider and get on the road to prevention.
Why do I feel so stressed and out of it?
I haven't been sleeping or eating. I feel like an outsider in my own family.
Why am I so easily irritated? Who can I talk to about this?
Who can I talk to about this? The first step was the hardest, but as soon as I opened up and told someone about the thoughts I was having, I felt better immediately.
My healthcare provider helped me to work through the mental issues I was having, and pretty soon, they just weren't there anymore.
It wasn't easy, but taking that first step can make all the difference in the world.
Now I'm in control.
Now I'm in control.
Take control of your health. If you're feeling low, overly stressed, or even if you just want to get something off your chest, take the first step and share your concerns with someone. Together, we can improve your quality of life.
At Green Cove Springs, Florida, Naval Hospital Jacksonville is piloting an emerging treatment approach with the PX Equine Enterprises to improve the emotional, psychological, and social well-being of its post-deployed service members who suffer from combat-related stress. The therapy uses horses to help participants experience themselves differently and discover new ways of dealing with difficult situations.
It allows them to figure out how to communicate, we've seen a lot of change in terms of their ability to be patient, to regulate their emotion, because horses are very sensitive and pick up on that. It's allowed them to show compassion in a way that they wouldn't normally be able to do that, whether it's grooming the horses or looking out for their health, protecting them.
One post-deployed service member who was diagnosed with post-traumatic stress disorder after a deployment where he lost 4 of his friends chose this therapy for its unique hands-on approach.
It's pretty awesome. I've been through a lot of PTSD programs. This is the only one that's pretty much kept my attention. So it's a confidence builder. At the same time, it's kind of unnerving because now you have the responsibility of this horse who, will follow you around. Doesn't matter if you're pulling on her or not. And so you have a responsibility. So it kind of reflected a lot on my relationship.
A relationship with his wife, who he said is excited about his enthusiasm toward the therapy, among others. Naval Hospital Jacksonville hopes to combine this therapy with other therapies as the basis for a new immersive day treatment program in 2012. From Green Cove Springs, Florida, I'm Petty Officer Gary Granger, Jr.
Since I retired from the Navy, I've gone to so many doctors and started so many pills, I lost track of them. I knew it was time to start managing my medications better, but I didn't know where to start. I realized that the first step in getting my medications under control was to get actively involved. My healthcare provider advised me to make a full list of all of my medications and to even bring the bottles in if I wasn't sure what was what. I keep this list on me at all times and update it as my health needs change. Working together, we were able to actually cut out a number of medications. Now, whenever a new health issue comes up, I ask questions about doses, side effects, and the correct times and ways to take the medications. I no longer feel lost. I feel empowered.
It's easy to get back on track with your medications. Start a conversation with your healthcare provider or pharmacist today and take control of your health.
I used to think all I had to do for my heart was basically make sure it was beating. Then one day during a routine checkup, I realized there was a lot I didn't know about my heart and how I can take care of it. My healthcare provider told me that with my family history of heart problems and my cholesterol and blood pressure readings, there were a lot of issues I had to pay attention to. But he assured me there was still plenty of time to reverse those problems if I made some small lifestyle changes. To keep my weight under control, I'm doing light, regular activity and making smarter choices when it comes to my diet. And I feel like I have more energy than ever before. Now I'm in control of my heart health.
Heart disease is the leading cause of death for both men and women. But you have the power to change that. Eat as much healthy food as possible and get moving. Take control of your health and make your heart happy.
Getting diagnosed with diabetes is like having a heart attack or stroke. By the time you know you have it, you're already a statistic. Luckily, there's a number that's on your side. My healthcare provider helped me understand that knowing and monitoring my weight is the first key step in preventing this serious and growing disease. I learned that small, incremental changes to my lifestyle can help control my weight.
Whatever you like to do, do it.
With proper diet and activity, and regular meetings with my healthcare provider, I'm doing everything I can so I'm not at risk.
Take control of your health. Get a scale, know your weight, and talk to your healthcare provider about any questions or concerns. And remember, just a few small lifestyle changes can add up to a life free of diabetes.
Darnell Cookman Middle School High School of Medical Arts played host to Naval Hospital Jacksonville's Science, Service, Medicine, and Mentoring Program, or S2M2, a program designed to encourage, nurture, and enhance high school students' interest in pursuing careers in science and medicine.
We're very proud of our relationship with Naval Hospital Jacksonville because it affords our students an opportunity to experience real-world application of what they've studied here in school and to see the diversity of the medical field.
During the event, Naval Hospital Jacksonville clinicians shared inspirational stories of their careers in Navy medicine and the paths they took to get there. Along with the formal event, smaller groups of students were able to spend quality time with the Navy clinicians in an open forum.
So live your life with no regrets.
S2M2 program, Science, Service, Medicine, and Mentoring program, is an opportunity for medical professionals to interact with students who have a desire to pursue that as a potential career. We've had the opportunity to experience and go through many different training pipelines to get to where we are today. These are pathways that the students are considering doing, so by being able to give them some information and actually some experiences when they come for the summer program, they can look to see what do they envision themselves doing that as a career.
From Jacksonville, I'm Jacob Sipple.
Being a military family, we were used to moving every few years. But how would it affect us now that we had kids? Luckily, we decided early to consult our military health care provider.
Can we take a listen to you, make sure everything's okay?
He answered all our questions and helped us put together a custom roadmap for her health. Now we know what to do to help prevent obesity, diabetes, and other health issues.
It's good to know we're instilling healthy habits early on in her life and ensuring we can all stay healthy as a family long term.
It's good to know we're in control.
Raising a child is definitely a challenge, but it's a challenge that should be rewarding and positive. Visit your healthcare provider on a regular basis to make sure you're taking advantage of preventive measures. Take control of your child's health and well-being. Put them on a path to a happy, healthy life.
You all are critical, absolutely critical to the mission. We could not do it without you.
Naval Hospital Jacksonville Commanding Officer Captain John Lefevre proclaimed May 3 through 9 as Public Service Recognition Week throughout its 6 facilities in Florida and Georgia. The week gives the chance to reflect and thank the almost 650 civilian men and women who serve as physicians, nurses, and support staff for their dedicated work.
This is an outstanding opportunity to step back, take a week, recognize the outstanding work that our civilian shipmates provide to us. These are individuals that may not wear the uniform of our nation, but they certainly are dedicated and under an oath to defend the Constitution of the United States, just like our military. They take care of us. They stand by us side by side, shipmates through and through.
The theme for Public Service Recognition Week 2015 is Government Works. The theme reminds the nation of the important roles federal workers play in ensuring the U.S. government works at all federal, state, county, and local levels. Naval Hospital Jacksonville Civil Service Team demonstrates this daily by the attentiveness they show to more than 71,000 enrolled patients across the command.
We have contract military civil service staff. We all work side by side. We work closely together. We work as a team. Obviously, there are ranks, and there's also leadership structure. But regardless, we do work together as a team. And it's all for the greater good of our patients, to ensure that our patients get good quality care, because that is ultimately
the most important thing.
Today, almost 3 million strong, federal employees are researching cures for cancer, developing solutions to address energy and climate crisis, serving alongside warfighters, and caring for the nation's heroes. These public service workers are normally invisible to the people they serve, as they work selflessly behind the scenes to ensure that the U.S. government is the best in the world. From Jacksonville, I'm Jacob Sipple.
I'm in my early 30s. I stay pretty active. I thought I had years before I needed to worry about my bones and joints. I mean, conditions like arthritis and osteoporosis only affect old people, right? So why am I in pain? I put off telling my healthcare provider for as long as I could.
Hi, Mr. Smith. How are you? I'm Dr. Manhart.
When I finally went in, I was happy to find out that I still had a lot of time to work on my bone and joint health. My healthcare team is helping me work on my diet and exercise habits. I'm keeping my weight under control and doing activities that cut down the risk of damage and injury. Now I'm in control of my health.
Remember, even just 20 minutes of exercise a day can prevent osteoporosis and arthritis. Take control of your health. See your healthcare provider.
When we found out we were pregnant, we were ecstatic at first. We realized we had a lot of questions we didn't know how to answer.
From the very first visit with our healthcare provider, we already felt better. He went through all the stages of pregnancy and early infancy with us and told us what to do if we needed help.
We felt nervous asking questions at first, but realized that questions are the best way to get the information we need.
Not only were we prepared for when the baby came, but now that we're raising our first child, we know what to expect.
Now we're in control and can concentrate on what's most important.
Starting a family is an exciting and challenging big step, but there are resources at your fingertips to make the transition as smooth as possible. Ask early, ask often, and take an active role in knowing what to expect. Take control of your baby's health. Visit your healthcare provider.
Naval Hospital Jacksonville was today awarded the first Ambassadors for Health Gold Star recognition for achieving the highest national standards for a tobacco-free workplace during a ceremony with Assistant Secretary of Defense for Health Affairs, Dr. Jonathan Woodson, and Prevention Partners.
What Naval Hospital Jacksonville has demonstrated through its program to reduce tobacco use and create a tobacco-free environment is really about creating a new environment in which people can be healthier in a work environment. We really are trying to reach out to where people live, work, and play to ensure that they make the healthy choices and that the environment is set to give them a quality of life and prevent disease in the future.
We work with leaders across the nation to ensure that the places where we work, learn, and receive care are healthy. We make healthier choices when we have healthier choices. And hospitals are early leaders in the efforts to make workplaces healthier.
According to World Health Organization, tobacco kills up to half of its users, nearly 6 million people each year. More than 5 million of those deaths are the result of direct tobacco use, while more than 600,000 are the result of non-smokers being exposed via second-hand smoke.
As a family doctor, I see every day as my patients come in the implications of obesity, tobacco use, and poor fitness. So I sought to build the program here at the hospital to create a healthier environment for staff members and for patients.
The recognition underscores Naval Hospital Jacksonville's ongoing commitment to encourage healthy lifestyles and choices for its more than 70,000 enrolled patients and 2,300 staff throughout Florida and Georgia.
To be a part of the Healthy Base Initiative and the Partnership for Patients and the Healthcare Ambassadors, to be recognized as the first hospital to achieve the Gold Award is, again, just a phenomenal recognition of the great team effort that we have here at Naval Hospital Jacksonville.
From Jacksonville, I'm Jacob Sipple.
I'm active, I take care of myself, and my husband and I are starting a family. Home and work life are stressful enough.
So I shouldn't have to worry about my health for a while, right?
That's what I assumed. Until I sat down with my healthcare provider. A visit to your provider is the best chance to take control of your health. to share with your doctor and ask questions in a private, friendly environment. To find out your unique health risks and the rewards that can come from preventing health problems before they start. My life isn't slowing down, but it's good to know that I'm in control.
No matter your age, your background, or health issues, there's always something you can do to improve your lifestyle. Most of these issues can be addressed with just a small adjustment to your diet and your daily routine. Take control of your health. Visit your healthcare provider for more information.
You may not realize it, but if you smoke or have ever tried to quit smoking, you are an addict for life. Whether you're like me using tobacco regularly, or if you just smoke occasionally, there's something else you may not know. You are not alone.
Good morning, everyone. My name is Brooke.
I'm in my 3rd month of no tobacco.
Good morning. Come on in and have a seat.
And even though I relapsed a couple of times, I know I'm on my way to changing myself and my mind for the better.
If you need anything, we're here.
I know I can quit,
No embarrassment. It's an addiction.
but I also know now that I need help to do it.
I'm a former smoker who knows how much harder it is to quit than the one-syllable word implies. I also know how possible it is to actually do it. Take control of your health, see your healthcare provider, and move beyond tobacco.